In neurosurgery and endovascular in and of itself, we get to fix problems. So it's nice when somebody comes to me and says, hey, this is broken, this needs help. And we go, okay, yeah, I can fix that. I work in cerebrovascular neurosurgery, so we kind of work with the arteries and the veins in the head and the spine. A lot of the patients that I see are kind of the ones where it's an incidental finding on some imaging, such as like a CTA or MRA, and then they find something they weren't looking for. And so patients are coming in and trying to figure out what they want to do about these things, or whether or not it's something that we need to do surgery on. And then patients that kind of come through the hospital, and then we're following up on the outpatient side of things. If it's something we need to be worried about, kind of develop a plan to figure out where to go from there. The relationship I have with my patients, I really kind of look at it like collaboration. I really like just having conversations with my patients. I don't usually go into appointment knowing what I'm going to do, so I think it's more about seeing where they're at versus where I am, and kind of where my education and experience comes from and where theirs come from. And then we go from there as developing a plan, whether or not it's something that they feel comfortable or not comfortable about, or how aggressive we need to be. We have lots of fun new devices and different kind of treatments that we do, so which is really great. We have a lot of new stents, a lot of intra-arterial devices that we use that we've just gotten in the last few years, and we're one of the only places in the country that have them, which is very awesome. There's a great collaboration between the neurologists and the neurosurgeons and the endovascular providers, and also we work really well with rheumatology and when we have our really complicated, highly complex diseases. So we always get together. We're always willing to talk to our colleagues about the patient so that we can make sure we have the best plan. I think what truly makes this job most rewarding is the people. I genuinely like the relationships I build with my patients, and I have several I would call friends. Outside of work, I have 2 boys, and they are crazy, and mostly my job is to make sure they don't break anything.